And we're back.
Hello, everybody. Good afternoon, good evening. This is Dr. Shiraz Farooq and Sydney Farooq. Hi, guys.
How's it going? Thanks for joining us.
We guys are back at DaBootyDoc Talk.
That's right.
This is happening in Tampa, Florida at Colwell, America.
Aww.
Hi, guys. DaBootyDoc Talk.
Thanks for
Shiraz
joining.
and Sydney.
That's right. So we're here to bring you another episode. We're on episode 20 this week. We got an important topic about your gut, of course. We're going to relate it to that.
The gut and the butt.
And the butt. So if you'd like to know what our topic is today.
Today's topic, guys, is very interesting and very common. It is about the role of antibiotics in colon health.
Mm-hmm.
Antibiotics are something that everybody uses all over the world, and we all know what this word means, antibiotics.
But do we know what it does? So we'll be talking about that today. If you haven't joined our show before, just keep in mind this is our typical frank conversation about an important colorectal topic about either digestion, colon health, whatever it may be. And we're here to bring you a little entertainment, some education, but strictly no medical advice.
Yes, guys, my name is Shiraz. I'm a colorectal surgeon, board certified, and this is my spouse, Sydney. We are all here every Thursday to educate you a little bit, but make you laugh more. And hopefully this episode will have some pun.
And good entertainment value. Don't try too hard now.
I know, I won't.
So again, episode 20, we're talking today specifically about antibiotics and how they affect your colon and your digestive health. So doctor, take it away. First, what are antibiotics?
Guys, even before that, I want to ask anybody, does anybody know what a bacteria is? Bacteria are tiny, tiny microscopic organisms that were discovered when the microscope was invented 100 years ago. But we didn't understand what bacteria did and how bacteria were killed until Louis Pasteur in the 1930s, with his petri dish experiments, was able to create penicillin.
Were these human experiments?
On a petri dish. Well, and then they did human experiments later on, but
before biomedical ethics.
No, they had ethics at that time. So the experiments at that time led to the first antibiotic that we know, which is penicillin.
Which a lot of people are allergic to.
Yes, so penicillin at that time was the first medicine that we know of that was able to kill and reduce the bacteria that were there. So bacteria are microscopic organisms that live everywhere, in the air, on the table, on us, on my glasses, on Sydney's glasses, on the phones. And
quick, get your LED light, your UV.
So bacteria are invisible to the naked eye, and you have to look under a microscope. And antibiotics are a class of medicine that helps to either reduce the number of bacteria or kill the bacteria. So they are bacteriostatic, meaning they can decrease the number of bacteria, or they are bactericidal, which means they can kill the bacteria. So these antibiotics are different classes, different medicines, and they are helpful for fighting against bacterial infections.
This sounds very concerning. You want me to take something and kills all of the bacteria in my body? Some of my bacteria is good. I like it. I don't want it gone.
I like your point because you're making a very important point.
Bactericidal?
Bacteria are good for you and bacteria are bad for you. So this whole topic today is about the good, the bad, and the ugly. And we want to know what the good bacteria do and what the bad bacteria do, and how do they affect your colon health and my colon health and your colon health. So we're all in this together, and colon health is something we all talk about.
Now, we've talked a lot about microbiota. You've probably heard that term in a lot of our episodes. So
what is microbiota?
Well, as far as I know, it is the collection of the good and the bad and the ugly bacteria in your body.
That's a very good statement.
What is it specific to the colon or the digestive?
So microbiota basically live on your skin, on your hair, inside your tongue, and inside your nose, inside your ear, and inside the digestive tract and the lungs. Mm-hmm. So microbiota are basically microbes, including bacteria, including viruses, including parasites, and other microscopic organisms.
So let me guess, all the microscopic living stuff inside of us.
Yes, the jiggly little movement that happening microscopically, you can't feel it, that's going on.
Spidey sense.
So they're basically all around us, okay? They are in
And within us.
and within us. So we breathe them, they live in us, and they are a part of us. So that combination of trillions of these microorganisms and ourselves makes us a human being or an animal or a living being.
Is that an accurate count?
Trillions and trillions?
Have they been counted specifically?
No, there are trillions and trillions.
And I'm guessing there's different strains of different types.
Different types and different colors and different shapes.
And I'm assuming if there's trillions of them, we probably don't know much about most of them.
We don't know anything, mostly. I mean, humanity for the last 100 years has just found out about antibacterial medicine, and we are trying to learn more about it. And this topic is so vast that in the last 20, 30 years, we've just discovered probiotics and prebiotics. So we are talking more about that also.
Or if it's in time of need, like COVID, then everyone jumps to the plate and we learn about it real quick then, huh?
Yes, and that is about viruses. So viruses are different than bacteria. So antibiotics do not work on viruses.
Good to know.
That's a very important
So if you're not
take-home
feeling
lesson.
well, it's usually important to find out if you have a bacterial infection or a viral infection
Or
to
a
determine.
fungal infection or a parasitic infection.
Too many
So there are too
infections.
many pathogens out there. So we have to be brave and fight all of them in the right manner.
And our body kind of does this for us, typically.
Yeah.
So we have a system like that. If I get sick, I should have some sort of defense mechanism.
We
right?
have many defense mechanisms. We have systems for it. We have the immune system, we have the lymphatic system, the blood system, the digestive system, the neuro system, the pulmonary system. We are a bunch of systems.
Fair enough. I'll take it.
Yeah.
So we want obviously good gut health,
Correct.
and that's what antibiotics were created for.
Correct. So antibiotics basically are helpful in the digestive system to help our digestion. They are also involved in the nutrient absorption and also boosting the immunity. So they have very big roles inside our
Yeah,
bodies.
that's not small stuff.
No, this is really important. So if you eat anything, it goes from the mouth and comes out to the butt. During this process, a slice of pizza becomes poop, and so does an apple. So these two different products are going through the process of digestion, which means that we extract all the calories, the fats, the carbohydrates, the nutrients, and the body also makes gases and ferments the food and makes food for the bacteria from them. They don't eat apples and pizza.
You sure?
I'm absolutely sure. They eat certain other chemicals which are made from the fermentation of these products.
Okay, makes sense.
And those are short chain fatty acids and other elements that can help you with that.
So we're getting probably good and bad bacteria from what we digest.
And that's why it's important to know what to eat. Sometimes you can get sick from eating food, and that's because there are bad bacteria in them.
Should I eat the moldy grapes in my fridge?
Probably not. And
What about like with people that theorize, a little bad bacteria might be good for you, like pick it up off the floor, don't eat, 5-second rule.
the 5-second rule applies. I think if you're taking heaping scoops of dead fish that is rotting and you're eating that, you're going to get sick.
Probably gonna get sick.
But if you're picking up a piece of fruit that fell on the ground and you quickly pick it up, wash it and eat it, you're probably going to be okay. Unless you're in a COVID lab with lots of bacteria.
I was gonna
etc.
say, or do you remember during COVID when we were all like hand washing every individual piece of produce that came from, I was even wiping off jugs of things.
So there's a lot of thought about that you don't need to overdo it. You need to clean and you need to be hygienic, but that can also prevent you from getting a healthy dose of the good bacteria, which helps to fight and prepares your troops for battle.
So you don't want to be too sterile in
Too
your environment. So your gut bacteria is also creating a system inside of you that is like the right environment for the
Correct,
right
correct.
balance of good and bad bacteria.
Exactly. And if you don't have that, then you can end up into big trouble.
In what ways?
In what ways? Well, in the digestive system, in the colon and in the intestines, if the bacteria are not right, we call it dysbiosis, meaning there is a imbalance of the good and the bad, and then the ugly rear head. So we are trying to eliminate the ugly by balancing the good and the bad.
So sometimes antibiotics come into play, sounds like.
Correct.
And that's
these
when you
medicines
have
come into play.
too many of the bad bacteria that you don't want.
And what happens is that the antibiotics that we have are non-selective, meaning you take a pill, it's going to go inside your stomach and then the rest of the small intestine and the colon, and it can kill the good and the bad bacteria together. And when that happens, the race may be dependent on your biology as well as your immunity and your systems.
Now, I've researched like different antibiotics that I've been prescribed before to a couple of things, like make sure it doesn't contraindicate any other medications I might be on. But I noticed that a lot of times, like one specific type of antibiotic might cover a whole range of, bacterias or infections too.
So when we found out about medicine like antibiotics and we started to experiment with penicillins and other chemicals, we realized that some medicines kill all the bacteria and some medicines kill only specific types of bacteria. And what we are realizing is that we don't want to kill all the bacteria. You want to be able to be as selective as you can.
Okay.
So certain classes of antibiotics are actually helpful because they isolate certain bacteria only and they kill others too, but not in that amount.
Okay.
So that's why it is important to talk to your doctor, your surgeon, your nurse practitioner, or other providers and seek help.
Get prescribed. Don't just take, we'll talk about that more later too, but if you have some antibiotics from your husband left over or your kids in the medicine cabinet, there's a couple pills left. You don't want to do that. You want to go find out a little more details first.
Exactly. That's one thing we touch about is that don't try to take somebody else's antibiotics.
Yeah. So
it's not candy.
If you're taking antibiotics, there's, it's medicine, but there's still some concerns. There's still risks involved or side effects. I know like people can have allergic reactions to it.
Yes, like you were saying, some the penicillin can cause allergic reactions and other antibiotics.
I'm, for example, allergic to amoxicillin. I know that from when I was a child. I don't know what my reaction is, but I know I probably shouldn't take it.
And the reaction can be a skin rash. You can get redness. You can get itchy skin, or you can get flu-like symptoms. You can get blisters. You can get bleeding. You can get diarrhea. You can get nausea, vomiting, gastrointestinal upset, fever, chills, seizures. So there's a lot of things that can happen from medicines, guys. Medicines are something that are dangerous, but effective and helpful. So you have to be careful how you take it. Talk to your doctor, talk to your physician, your surgeon, your provider, and hopefully they will guide you in the right direction and get better.
What about, we're specifically colon and rectal health. So in terms of that, there's some colon and rectal diseases that might be affected more than others to bacteria, like ulcerative colitis or Crohn's disease. How do these patients deal with taking antibiotics?
So that's a very good question. Inflammatory bowel disease, which is an autoimmune problem that we don't know exactly why it's caused. It causes inflammation inside the colon and the small intestine and large intestine for Crohn's. And what it does is that your lining gets destroyed. And when it gets destroyed, bacteria that grow there can overcome and can multiply and can eat the tissues. So these bacteria could be inside the colon that you have, or they could be outside from food and other stuff.
So if you already have a diseased colon or digestive system that's unhealthy, you might be more prone to getting harmed by using antibiotics.
And sometimes if you have infections caused by a decrease in immunity and you get a bacterial diarrhea, bacterial colitis, for example, then you may need antibiotics to treat that. So there are also antibiotics to help, and there are antibiotics that can make it worse. So a big class, we call it C. diff colitis. When we talk about the ugly bacteria, there's a Clostridium difficile is a class of bacteria that multiplies when the good bacteria are low in numbers. And this bacteria, what it does is that it causes profuse diarrhea. You start to get runny bowels. You start to slough off the lining of the colon. And sometimes the disease is so sick that you may need to be hospitalized. And sometimes it may lead to terrible things like getting very sick or sometimes death.
And be cautious too, because, for example, if you're having excessive diarrhea or other problems, you might be getting dehydrated or having other symptoms that aren't presenting themselves until you end up in the hospital.
Correct. So hydration is very important, taking the right medicines, and avoidance of these antibiotics unless prescribed for the right reason is a huge thing.
Can you take too many antibiotics? Like say I got C. diff and I do one treatment and the course doesn't work. Do I get prescribed another? Do I prescribe a different? What am I doing?
So what you're doing here is that you may be developing resistance. Now, if you're a Star Trek, if you're a Trekkie, you will realize that what I'm saying next is important. Resistance is futile. This is one of the catchphrases by the Borg, okay, which is the AI cyborg total nerd. Okay? So resistance is the way the bacteria fight back.
Okay, wait. Do astronauts have to worry about bacterial infections and stuff?
Ooh, that's a very good question. Yes, astronauts have to worry about that too, and they have to take certain antibiotics. Before they go out in space, they have to be isolated from everybody else, and they have to get their blood testing and all that. So space medicine is really amazing.
Space medicine.
Yes,
Never
there is something called space medicine. So
new degree.
there are new pathogens that are being discovered
In space or on Earth?
On Earth, and they have not found living organisms so far that I know of on Mars or Moon or something, but they're looking for them.
They probably have sent a couple sick people to space too,
Oh,
just
yeah,
to see what happens.
they have sent dogs and animals and stuff, and they have treated them.
Not the
There's
space
a lot
cats.
there's a lot of experiments. Space monkeys.
Did you know that they sent a cat to Earth's atmosphere
Yes,
in like the 60s, and he came back down and survived? A little messed up in the head, but
I think the Russians beat us to it. They had a dog.
Yeah, but
It
space
was
dog
the
didn't make it.
The Sputnik dog.
I don't
Was
think
it?
space dog made
I
it.
can't remember. I don't know. Anyways, I have to look it up and talk about it. So resistance is something that bacteria, if they are treated with one antibiotic and they are dying, they will release a chemical which will tell
Not the person dying, the bacteria.
the bacteria is dying from, say, there's 100,000 bacteria and you kill 50,000 of them. So the remainder 50,000 have now adapted, and now they may release a certain chemical to fight the effect of the antibiotic, so they may not die. So they may actually multiply, and twice they
You
may
never
become
said that
200,000.
these bacteria were smart, okay?
No, bacteria.
Another level.
Bacteria are smart, and so are we. So we have to just outsmart them. However, bacteria have been around before humanity. They found bacteria in ice cores that they have drilled into the.
This is a concern of global warming.
Yes. So as global warming comes and these glaciers melt, you might find some resistant bacteria that have been hiding, and they may be reactivated again. That's the Jurassic Park version of bacteria.
So don't go hiking on melted glaciers for your vacation. Or don't eat the yellow snow. It might be purple or green too.
Yes, that can happen also. So these are all things that we worry about and talk about. So resistance to bacterial infections happens if you do not complete the course of antibiotics, if you don't kill the bacteria completely, or if the antibiotic is changed quickly, or the patient's immune system changes. So there's a few things that you have to worry about.
And this is all guesswork.
Yes, because science is guesswork until proven otherwise. We're experimenting every day.
So you really only want to take an antibiotic when necessary. It's not something, sometimes we get these patients and we're like, it didn't work, you need another dose. And we're like, no.
So your question about the inflammatory bowel disease also relates to IBS, irritable bowel syndrome patients. And we have realized that some of these patients who have been taking antibiotics for a long time and have suppressed their immunity, and now they develop other medical problems. And maybe irritable bowel syndrome has a link to it, maybe arthritis and other medical
Because our
problems.
society's been dishing out
Microplastics and antibiotics. You know, antibiotics are now in every major ocean and river and in the water. Antibiotics also. So microplastics aside, antibiotics are in animals because we are feeding them to the fish, to the poultry,
life cycle thing.
and the life cycle thing. So they eat it and we eat it, and then
Trickles down. So you can eat grass in case you run out of antibiotics, and you just might pick up a little something.
That's grass. Grass is covered with microplastics also. Don't worry.
Grass, seaweed.
Human beings are doing a terrible job with that.
So, what about if you do have an allergic reaction to antibiotic? Are you stop taking it?
So allergic reaction.
Continue taking it? You just said like we need to continue the course if you're on it. What do we do?
So at that time, if you are having an allergic reaction, stop the antibiotic. Please seek medical help. Talk to a doctor about it. You may need further medical therapy. You may need another course of antibiotics or some other medicine to help with that. So there are ways to help around that. Science is slowly, gradually walking up to it.
And what was I going to ask you? My thought just came and went. So out of my mind.
What do you do? How do you help
What was I going to ask
people?
you? Sure, that's a good question.
The question here arises: what do you do when you're on antibiotics, and how do you help the body? You know the answer.
Oh, I know what I was going to ask you. I was going to ask. We talked about already kills your good bacteria and your bad bacteria, which we want to kill. But now I'm like, my immunity might be lower. My system is like, I don't know what's going on. How long does it take to recover from this?
It may take many weeks to months, but there are ways to help it. So that's where I was
what we
coming
didn't
to.
talk about.
Yes, how do you help somebody who's on
Minds are
antibiotics?
connected.
Yes, thank you guys.
So we need to feed ourselves some
Probiotics and prebiotics.
Right.
So these are two things that are important, guys. Probiotics are a bunch of live bacteria that are present in some foods, like yogurt and kimchi and fermented drinks or fermented foods that have been grown and are present all over the world, consumed by cultures all over the world.
Or you can buy these fancy supplement products that are strains of bacteria in powder form or liquid form.
Now we know that. Now there are many, many different types of probiotics that are available. Probiotics are extra bacteria that are living that you eat or drink.
Remember, they're microscopic.
They're microscopic.
So don't buy that probiotic from the gas station that's moving.
They're not moving. They're not jiggly. But they can be dry probiotics, or they can be live, cold, restored probiotics. And they have different efficacies and different uses. So probiotics can be good for your digestive system, good for your lungs, good for your skin, good for your hair.
And as far as I know, there's hundreds of strains.
Yes.
Maybe more. So you can have better strains for better purposes.
And that's what we're learning. In the last 20, 30 years, we've realized that probiotics can help. But we're also realizing that prebiotics are important. Now, prebiotics.
What's a prebiotic?
So prebiotic is non-soluble, undigestible fiber. So when you eat plant food, when we say plant medicine, eat plant-based diet, vegan, vegetarian, all the stuff out there about the green stuff, it's basically trying to tell us that we need to eat more prebiotic stuff. Because prebiotics, when they are eaten like fibrous fruits and fleshy vegetables, these are not completely digested. These ferment inside the colon, and then we pass gas, and methane gas and other gases are formed. These gases formed chemical reactions. And these chemical reactions form food for the bacteria. So your food is indirectly coming from the apple that you're eating. The apple ferments inside the body and feeds the gut bacteria.
So when you fart, are you feeding the bacteria that are floating around?
Well, you're at that time the gas is exploding up, so it's not feeding anything, but the other gases, including methane gas, that you are making inside your colon, is helping to do that. So yes, we all pass gas, we all make gas inside us, and those gases and react with other chemicals and make food that is healthy for our
And that's why
bacteria.
it's important, for example, if you're shopping for fiber products, you want to have both soluble and insoluble fiber.
And insoluble
So,
fiber
that's
is
the key.
very healthy for your gut. So prebiotic fiber, here I always talk about the magic pixie dust, flaxseed fiber. Flaxseed has been around for thousands of years. It's a plant that is all around the globe. You can find it. It's tiny little seeds. You have to crush them.
Yeah.
Crushed ground flaxseed can be sprinkled on your food, your desserts, your shakes, your yogurt,
Kind of
etc.
has the taste of like sunflower seeds, I would
Correct.
say. It's very
So
neutral.
most plants seeds, and if they're crushed, they can be fermented as prebiotic fiber. So a lot of prebiotic fiber is basically crushed cellulose and plant material that is not digestible.
What if you have an unhealthy colon, like diverticulitis or ulcers, where you
Diverticulitis.
have like pockets in your, can you eat, is fiber dangerous for you in that respect?
No, fiber is still healthy for you. We know that in acute inflammation, you don't need as much fiber and you should rest the bowel. But in a state where there's just pockets, those pockets improve with addition of fiber. So prebiotic fiber is one of the tools to help bacterial health of the colon. So please eat your yogurt, put some ground flaxseed in it, put some honey in it. That's something I tell all my patients, and I tell
So
it
you need your
publicly.
prebiotic fiber
And
and
your
your probiotic
probiotics.
fiber. And if you search our episodes too, we have a specific episode discussing that, and we even talk a little bit about
The
postbiotics,
yes.
which we won't have time to go into today. But very important about the probiotics, because that's feeding your good gut bacteria, which you need to compensate for whatever bad bacteria you naturally have, or whatever overdevelopment or imbalance you have with the different types of good and bad bacteria.
You know, and taking antibiotics can also cause you side effects. You know, you can have diarrhea, you can have nausea, vomiting, you can also develop resistance, like I said.
So if you're messing with your microbiota in your gut, then you might have some symptoms like bloating or diarrhea or.
So the last minute I want to talk about was make sure that people understand a few things. Okay, very, very important.
Listen up.
Okay, take the right dose of antibiotic when it is necessary.
Yes.
Okay, don't take it if you are having a flu or some other infection that's common. They don't work for viral infections like a regular runny nose or something.
So don't self-treat out of your medicine cabinet. Okay. Contact a doctor.
Take the complete dose of medicine. Finish the antibiotic, whether it's for 5 days, 3 days, 10 days, 12 days, 15 days. There's a reason for that.
You start feeling better. Day 1, day 2, it does its job. It's medicine.
If you stop the medicine, then the bacteria that are already dead will, the bacteria that are alive will fight back. So you need to kill them completely. So you need to complete the course. And you need to do it at the right time with the right doses so the medicine is in your bloodstream and works properly.
And don't share with your family members.
Correct.
So if you're all C. diff affected, you all need different medication.
Or you may need it, but you need to wash your hands and get better. So hygiene is very important. Eat healthy food, and please, please, please wash your hands. Wash your hands when you eat food, when you touch an animal, when you touch other people. You can do a lot of things. So hand washing is very important, especially after COVID. We've realized that viruses, bacteria, parasites, these are all creeping up to fight us, our bodies.
Very simple measure.
So,
and you don't realize how many times a day you're sitting there touching your face, doing this and that, chewing that. So
and your hands and your feet are touching everything. So please
Don't put your feet in your mouth.
Cleanliness is next to godliness, and that helps with your colon health.
That's right. So that is all we have time for today. So
Thank you, guys.
eat more fiber, wash your hands, and tune in next week to see what we're talking about. We'll post it on our social media. Let us know if you enjoyed the show, questions, comments, whatever it may be, something you want to ask, talk to us. We're here for you.
This is the DaBootyDoc Talk with Shiraz and Sydney. We're signing off, guys. Thank you so much.
Peace out. Have a good night.
Thank you.
Thank you.
Bye-bye.